Yes, I'm one of the people you hate to see, and generally after a hunt most people will come in and go, didn't need to see you, so that's a good hunt, even if nothing much came from it. But before I start off, I think if I, actually no, I'll give a quick, so that's me. So, been doing the job for a little while now, and over the years I have seen a few pig rips for sure. But what I definitely notice now is I'm not seeing so many. And I think there's more people hunting, so does that mean that you've got better dogs? Doubt it, but I think what it means is that you are being a bit more careful. I think it means that technology is helping you to keep the dogs fresher. I think it means that you're getting to the pigs quicker, and so that the time for trouble is less. But I was vet on call during the Waitara hunt, and I didn't see one dog that weekend. Somebody else probably saw them all. They heard that I was on. So I think that's a good thing. So you have to be a bit practical about it. Have seen some horrendous injuries, but dogs are remarkable what they'll come back from as long as we do just a few things right. And right at the very start, which is you people, if you look after them well, if you get them in good condition coming off with their injuries, we can, generally the dog nature is going to heal itself and we can give it a bit of a hand. Wound healing. So, a wound happens. The first thing that the body does is it bleeds. And as it bleeds, it kind of maybe flushes a bit of stuff out, but inside that blood as well, there's proteins and there's fibres and there's stuff which just makes it clot and to fill up the hole. So there's lots of cells get into that area. And then the second thing that happens is that the body tries to clean itself up. And the cells in the blood, the cells in the blood, which are called white blood cells, special ones called neutrophils, that the first thing they do is they come along and they want to try and clean the inside of the wound. So that's where bacteria get swallowed up. But they're also going to try and get rid of the dirt. They're also going to try and get rid of pieces of panga or sticks or anything else. They're going to react to it. And that's what makes pus. Later on, if the wound has sort of cleaned itself up, the next thing that happens is fibrous tissue starts to form, and that's the scar. So the scar starts deep, but it eventually ends up on the skin. A thing called a macrophage. Long name, but all it means is macro's big and phage means it actually swallows things. So it's a bigger cell, swallows bigger bugs and bigger sticks. Eventually new blood supply has to get in there because a whole lot of tissue has died and has been swallowed up. And that's granulation. So if anyone's ever had seen a wound that's been open and it gets red and raw and kind of bubbly underneath, that's granulation tissue, and it can spread 1 millimetre a day and it can thicken about 1 millimetre a day. I think of that like a garden bed. As it drags new blood vessels in, that's going to be protected against infection because the blood supply can help to protect against infection. New cells grow in that, and the wound edges kind of stick down and start to pull together. And eventually a wound, even an open wound, heals, but that scar is always going to be weak unless the wound has been managed well. So how do we do that? First, we want to minimize pain, we want to restore the tissue, we want to minimize the scar, and we want to make sure that the dog will work again so that it can function. Now, to get a wound to heal well, it should be sterile. So sterile is the sort of wound that I make with a scalpel blade. And I can do those, and I can sew them back together, and I don't need antibiotics or anything else, and they'll heal fine. The next is a clean wound. And then the worst is infected or dirty. Every pig rip, every dog bite is dirty. Every dog bite, every pig rip is complicated. For it to heal, it has to be clean, at least. So how can we make it clean? Generally, like out in the field, what you can do is you can wash the wound. Now, we talk about using sterile saline, but not everybody carries around, oops, we'll do it later. Not everyone will carry around sterile saline, but if you've got a water bottle and clean water, and it's 500 ml, it's a teaspoon of salt. So you can carry a teaspoon of salt and a water bottle, and if you can find some clean water somewhere, you can just put it in there. It's not going to be sterile, but it's going to be the right saltiness. You can use disinfectants sometimes to clean wounds. But you've got to realise that disinfectants kill bugs and they kill tissue as well. So you put a disinfectant on a wound, you're actually going to kill some of the cells, especially like when we had that granulation, that garden bed that we wanted to help out, which is later on in the track. So water, so sterile saline, something that comes out of a bottle, first choice. Second choice, 500 mils of water with a teaspoon of salt, second choice. Third choice would be a disinfectant in water, but it's again 1 teaspoon of disinfectant stock solution into 500 mils. Now, iodine, say for example, comes generally as 10% solution as it's got it in the bottle. What you need to put on a wound is 0.1%. So it's 1 part in 100. Chlorhexidine is the same, it's just another antiseptic. So, but anyway, how can you keep them clean? You can wash them, you can clean them, but out in the field, what you can start to do is you can cover them. And we've got some kits, and you've all, I'm sure, had the staple guns. Now, please do not think that if you've had a rip that's long enough for you to staple, that you can staple it and get away with it. You might get away with it once or twice, but the object of stapling that skin across is to use the skin as its own bandage. So, first aid.
Just 1 minute. Just stress that this presentation is for pre-vet, not being the vet.
Sure. Okay. So, an injury happens. The first thing you need to do is breathe yourself and think clearly and not panic. So I've got 6 C's. So the first one is crap, it's happened. The second one is the common sense. Stay calm, think it through. Clean, cover, compress, and call us. So what you're doing is putting the dog in the best situation possible for when we get to see it. So, calm, clean, cover, compress, and call us so that we're ready. I've got a dog that we're going to I'll quickly run through some bandaging and what have you later. Okay, now bandaging. So to cover, if you have used the skin stapler just to cover a skin flap over, you're going to want to put something on top of it and bandage it. So it might be that you just do that out in the field and you get back, and it could be you've got a towel. Just fold it to about the right size, the right thickness, and apply that. Other things that are really awesome for wounds are nappies. They're great. So have one sitting in the ute or fold it up in your pack. They don't take very much space, and the cool thing about them is they're super, super absorbent. They've got lots of padding. You can also, for small punctures, if they're bleeding and you want to put something in there, if you were to carry your girlfriend's tampon in the pack, you can shove them in. They've got this cool little stringy thing that you can pull them back out with. Put them in there, and then a towel or something else over the top, and some compression, and they promote blood clotting super fast. Okay, so we've got padding, disinfectant. Remember, dilute it 1 in 100. 1 teaspoon, 500 mils of water. Dressings, we've got a bunch of dressings that we'll have a look at. We talked about clean. So wounds are best sterile, clean will do. So run on through there. Remembering that iodine and these all antiseptics kill cells. That's how they work. So we don't want them too concentrated. Keep it clean, staple it closed, cover it. Now cover could be something like a t-shirt. Now, I can't remember whose it was, but we had a guy, an old t-shirt, wrapped a towel, t-shirt around it, and his dog's bowel, his gut had been opened and its bowel was hanging out. He shoved it back in, pushed it, clean, and got it, kept it actually amazingly clean, and he carried it for hours to get it out, and that dog was fine. Unbelievable, but it was fine. Chest wounds, any wound around the chest cavity, even if it's a stick, assume that it's gone into the chest and that a lung could be collapsed. So what you've got to do is you've got to cover that, close that skin. So staple it, close it, but also just a towel or a bandage just when your back is wrapped around, just to put another layer on. Okay, so if you use a t-shirt, a bandage, a dressing, your own shirt, your own sleeve around the dog, something to act as a tourniquet or as a bandaging. Now, compression. When you are bandaging, we talked about that. Direct pressure, pad or nappy over, abdomen some compression. Neck wounds, we'll have a look at a neck wound later. So bandaging and compression. To get good compression, all bandages need padding underneath them to spread the load of the bandage on top. Now, in the clinic, I'll use cotton wool, and that's a 500 gram roll. And if a leg is bad enough, it will get that whole roll wound around it until it's about that thick. And then with my bandage, I'll try and put it on as tight as I can, so it almost becomes a cast without the need of any sticks or anything else like that in there. But even a lighter bandage will often roll down and will cause like bind on itself if you don't use padding. So I think back in the ute, if you don't want to card a whole lot of padding, you might have, say, half a roll of cotton wool just sitting somewhere, or you can just use towels. Again, folded up, wrapped around, and then tied on with the bandage. So padding becomes important when you splint, when you want to really compress over an area. Make sure that you do spread it, but you have to use whatever you can. So, and this is an example of a dog that came into us from a hunt which had an injury to its leg. So, kind of look at that and go, what did that achieve what the guy wanted, which was to stabilize it? Yes, it did, but it was still a bit wobbly because whereas electrician's tape is what he had and what he did was a good job, it can still move in there, and the bruising and swelling as it bleeds under the skin can still keep pushing out, and it just pushes in between places like where those tapes are, and it actually causes the tape to dig in and bite in. But he got the dog in pretty quick, so that wasn't too much of a problem. That's the other view, so you can sort of see the leg sort of going off at a funny angle. That was the fracture that he did. So he actually fractured his whole ankle hock area. Doesn't look so bad, that ankle, does it? That one, we patched it up, and in actual fact it went down to Massey where they put some special sort of titanium things in there and healed well, and the dog went back out hunting. Wounds and bites do need to be treated. Sometimes antibiotics is enough, but they do need to be treated. All of them are infected. Just remember, Skin staples are first aid only. The damage is always going to be more than skin deep. Sorry, just looking for something. I'll get it later. And the skin, you just use it as a bandage. Infection is inevitable. It'll always happen. Sometimes the body will deal with it itself, sometimes it won't. Now, if a wound breaks down, so we always try to get a primary heal, right? You try and get the muscles all tied together in the right way. You try to get the skin together in the right way. And how can we maximize our chance? You can get it clean, you can compress it, you get it in, and we then do what you kind of go, hey, it came in with a rip like this, but my incision was like that. And the reason the incision's like that, and the reason that we shave half the dog's side, is because it's going to be pockets. And we need to cut that skin right up to open the pocket and then cut away anything that looks infected, anything that looks contaminated, and anything that's in that pocket is that. So often we're cutting, debriding a lot of tissue so that we've got a fighting chance to get that to close first intention, because first intention is best intention. If it breaks down, it'll still heal. We can still get it to heal. But it's a commitment of weeks to months with loads of bandage changes, and if you keep coming back to see us, it's a large bill. I think one of the largest vet bills I've ever written for somebody was a wound on the side of this dog from an infected dog bite that took about 3 months of continuous bandage changing. It worked. We got to know each other on first name terms, but it was expensive, and a bit of pre-thought could have maybe saved that. And there are no shortcuts once we start open wound management. There's nothing we can do to make them go any quicker. So here's a couple of wounds. That one there. So there's a lot of dead skin involved with that. A lot of tissue needed to be resected back. And in the end, if you look at it carefully, you can see that I actually borrowed a bit of skin from higher up, and we turned it into a funny Z shape to close it down. And so that's one way of turning a rather large wound into a primary. But, you know, that was just a simple, started off, the people told me around the dog's neck it was a puncture bite just from a fight. And this is just as it got presented to us. Now, to try to get those things to heal, you can't just close that wound over. There's too much tension pulling it apart. So sometimes we've just got to put padding and material around it. So this looks a bit icky, but that lattice, so that shoelacing, what that enables us to do is every day, sometimes twice a day, you can get in under, you can undo your lace and you can pull it out, and you can have like sterile towels or bandages there, and various dressings. Honey is definitely one of my favourite dressings for those wounds, in that, and it can be any honey. Manuka is better, but it can be any, in that what the honey does, the sugars act as a natural antiseptic, but also there's ingredients in it which help just to nurture that granulation tissue. And if we look carefully, just in the middle of this sort of icky area here, you can sort of see that it's getting nice and pink and a little bit bubbly. And right up at the right-hand side of it, it's very bubbly, and that's good granulation tissue. So, but that wound itself, it took about 6 weeks to get to a point that it could heal. So, I think we've just quickly glazed over that. Now, a little bit about just straight care of the dog. Remember, you expect them to be an athlete. You expect them to function at a high level. So you got to put high grade fuel into them. So quality nutrition in. Generally, they've got a bit more energy. They've got more energy for the hunt. They'll go longer. They'll be fitter, and they'll get injured less because they are fitter and they are functioning better. So there's a huge choice of foods available. My personal favourite for a hunting dog, for a working dog, for one that's expected to go for hours, is in the Royal Canin range, and they used to be called, what's it, 800, but it's now got a new name, Energy. And look, it's just rocket fuel. It's just incredible. But you do need to look after their internal health. If you're going onto other people's sheep farms or across sheep farms, remember to keep them well wormed. Get a tapewormer into them before you go on, so that you can eliminate sheep measles. Externals, just fleas and ticks. You're hunting in sort of wild country often. Ticks are a thing. Ticks can take energy from a dog, so you need to make sure that they've got good external control. And disease prevention, vaccines, including maybe, say, leptospirosis as one of the vaccines that you're using. Okay, ask yourself, is my dog too thin? Never seen too many that are too fat. There are a few out there, but that. And then just, are they conditioned? Are they fit? My observations, generally I see it when people mix packs. So they might borrow a mate's dog, and it's always the dog they've borrowed that gets injured. That dog maybe is not familiar with the pack, and the pecking order is not established. You're not familiar with the dog. It has improved though. It has improved. So be proactive for welfare. Be proactive for care. Have a plan for when the injury happens. Go back to those clean, compress. Have a plan and justify it. And that welfare document that I talked about at the start, 51 pages. They're not all 51 pages of things to do. I mean, I think probably the first 10 are probably just the introduction. But if you can say, I've read it, I live it, I breathe it, nobody can argue that you're not caring about your dogs. Okay, so that's just a quick excerpt out of that, where the person who wrote that editorial said we need to be vigilant and make our case, and what we don't want is government making regulations and telling us how we can hunt pigs. So that in the end is, as an industry, if you can come out and say these are the things that we do to care, you'll go a long, long way. Okay, rightio. So we got our dog handy. Right. Okay. Now the other thing is, I assume that most of you have probably got some experience with skin staples. Yes, no?
Yeah.
No, it's okay. I don't need it back. When you are stapling the skin, I find that what you've got to do is you've got to pinch the skin together and then just put the device over and just go crunch with it. Okay. So make sure that you are giving it a good pinch and you work down. Now they have very little holding power apart from that direction, so you can't sort of use them to try and drag tissue together. You have to pinch it, and so I usually pinch it, so instead of the skin being edge to edge, I'll pinch it so it's like that. So you've got the cut edge on the top and the cut edge on the top, and then the staple just goes crunch down over that way. Okay, so be fast with it. Okay, shall we rip into it? Okay. That's okay. No, that's cool. Okay, so if we had, something in a good common place, just right in under the jaw there. You were super organised, and you had your folded up nappy. Just turn it inside out, and I fold it down so it's in a package. Or if you haven't got that, again, a towel. I'll just roll the towel up. This is not much fun up on a table that wobbles, is it? He's cutting the shapes. But okay, so we'll do the towel. So it's just basically bang in there. Oops a daisy. Now I'm going to just use, here's an old school crepe bandage, which to be fair I never ever really do use. It's that jugular there, so let's just get it around there. Now the jugular vein runs from under the ear to the entrance of the chest. You'll recognise when it's cut because there'll be a load of blood. But the good thing about it is it's low pressure, so if you can actually get something onto it like that, you'll be fine. Now build it up so it's thick over where you want to put the pressure, then there's not so much pressure underneath. The windpipe is cartilage and it's a solid pipe, so for you to crush that, you would need to actually have, if you actually had a bandage around in the front and you went tight, you might then start to close the windpipe off. But if you have it to the side, just over there, it won't. Now, the trouble with these crepe bandages is they don't stick to themselves, so you've either got to tear it and tie it, or use a bit of electrician's tape, or you can tuck them in underneath each other just like that, and it kind of holds as well. But we tend to, these, I guess the good thing about them is they are a bit reusable. But what we'll often do is, and have this stuff, comes under various trade names, but mostly it gets called vet wrap, even if it's the copy of it. Now it's got elastic in it and it sticks to itself, so on one hand it's awesome that it sticks to itself, and it's awesome that it's a bit springy because it'll just hold the tension in there, so do nothing, it just sticks to itself. And when you want to finish those off, you just pull it really tight, lay it down, and then you can just tear them. Okay, so that's that one there. No, it's not quite time to jump yet. Okay, the chest. So remember, any rip over the ribs, think that the lungs could have been affected. If there's a pick it up, pinch it, staple it, pad on, towel on. We do have good patients, don't we? Okay, now, so often the thing about the ribs is that the bandages kind of want to slip off because they're shaped like, so you've got to often just come up around the front of the body and kind of, if you have a look here, oops a daisy, that's really cool, that's that trick, and then we're coming over, and it's sort of like, almost like in a figure eight, and I can just get that just to sit there. So if anyone wants to come up and have a look at that a bit closer later, we'll leave it on. Shall we leave it on? What do you reckon? Okay, now the leg. If it's up over the shoulder, you still want to have either the nappy or a towel or a folded shirt or something just plunked straight on there. If it's a little bit lower, it can be the same sort of thing. Close the skin if you can, although lower down it's actually really hard. And say if it's that, you could be able to bandage on there. But what I would often do is I'd put my quick dressing on, and then when you got back to the ute, say for example if it had been broken. So this is, we saw the stick before. Totally on the wrong side, anyway, that's fine. Here. So So I talked about compression and getting padding. So that's, oddly enough, that's about the minimum amount that you'd generally want to have. But then if you've got the vet wrap, you can't really, with this amount of padding, you can't really, strangely enough, put it on too tight. Whoops, he's going. This my day started off really well. Where did my sticks go? Okay, then if you did need to put a stick in, now's the time to put that in just to give a little bit more. Good boy. And when you tap it, it should sound kind of like a pumpkin. It's nice and hollow when you do that. So that's enough to immobilise anything in and around that area there. I'm running out of bandages. Another one sticking around.
You're a member of the club, we might get a spot price.
Oh, I might. Cool. How much do I pay for my membership? You take them now?
$100 to you.
$100 to me? Bonus. $20 to anybody else? Yep. Okay, so here's so we had our wound up over there, so we wanted just to try and dress that one. So actually, this is one of the hardest parts of the body to do. So this becomes that figure 8. And you can finish the figure 8 off just around. Awesome. And look, the back leg is exactly the same. In the case of a male dog, they do have this thing that hangs underneath there. Don't worry about bandaging it in. He can cope for an hour or two. Rightio. There's some bandaging. So use what you've got available. The chest, compress it, because if there's a wound there. Now the belly, you do the same as the chest and then the legs, especially if there's been some damage to a bone or anything else. You want to get a lovely big fat. That's going to stop the bruising. That's just going to help give it some support and things like that as well. We'll take the bandages off later, but I'm sure he'll be happy enough just to. Someone wants to look. What do you reckon? You can breathe? Bonus. Here we go.